Welcome back, future doctors. Today we're learning about Acanthosis nigricans, an important skin condition that often points to serious underlying disease and is a favorite in exams. Acanthosis nigricans is an important cutaneous marker of insulin resistance. It can also occur due to hereditary causes, endocrine disorders, obesity, certain drugs, and even malignancies. It is seen more commonly in blacks, followed by Hispanics and least in whites. There are 5 types. Type 1 is familial, which is very rare, inherited in an autosomal dominant pattern, and appears in childhood, usually worsening at puberty. It has no association with cancer. Type 2 is the benign form linked to endocrine disorders like acromegaly, Cushing's, diabetes, hypothyroidism, Addison's disease, and polycystic ovary syndrome. Type 3, which is the most common, is associated with obesity and insulin resistance. Type 4 is drug-induced, seen with agents such as nicotinic acid, oral contraceptives, steroids, and in some renal transplant patients. Finally, type 5 is associated with malignancy. It usually occurs in non-obese adults, tends to be widespread, may involve mucosal surfaces, and is most often linked with gastrointestinal adenocarcinoma, especially of the stomach, though lung and breast adenocarcinomas are also seen. Clinically, most patients are asymptomatic, but the skin looks dirty, with a velvety, brown thickening, especially on the neck and axilla. Other possible sites include the knuckles, lips, umbilicus, eyelids, and even the conjunctiva. Diagnosis is usually clinical. Blood glucose and sometimes insulin levels should be checked. In non-obese patients with no clear cause, underlying malignancy must be excluded, and endocrine disorders should be investigated if suspected. Management depends on the cause. Weight loss helps in obesity-related cases. Treating the underlying endocrine disorder or stopping the offending drug can lead to improvement. In malignancy-associated cases, treatment of the cancer may cause regression of skin changes. Symptomatic relief may be obtained with topical urea, lactic acid, tretinoin, or systemic retinoids, though results are variable. Prognosis depends entirely on the underlying cause. Obesity and endocrine-related cases often improve with treatment, and malignancy-associated Acanthosis nigricans may regress once the tumor is removed. And that's the end of today's lecture. To recap quickly, Acanthosis nigricans is a skin disorder presenting with velvety hyperpigmentation, usually over intertriginous areas. It can be benign, familial, drug-induced, or malignant. The most common cause is obesity with insulin resistance, but in certain patients, it may point toward internal malignancy. Always investigate the underlying cause and tailor the treatment accordingly. I hope this video helped you understand Acanthosis nigricans in a clear and exam-friendly way. If you found it useful, don't forget to subscribe my channel.